Ligaments. The annular ligament of the radius. The annular ligament or orbicular ligament is a strong band of fibers which encircles the head of the radius and retains it in contact with the radial notch of the ulna. The ligament may be palpated indirectly through the muscles of the lateral aspect of the forearm just below the elbow. Use a firm gripping action with your thumb and index fingers, whilst your other hand pronates and supinates the forearm. Also, by exerting a destructive and compressive force through the radius, you may feel the movements of the radial head in relation to the annular ligament. The inguinal ligament. It is formed by the aponeurosis of the external abdominal oblique muscle. It extends between the anterior superior iliac spine and the pubic tubercle as a thick band, and it is continuous with the fascia lata of the thigh. The medial collateral ligament of the knee. It is a broad, flat band situated slightly posterior on the medial side of the knee joint. It is attached proximally to the medial condyle of the femur, immediately below the adductor tubercle, and spans the medial aspect of the knee joint to attach below the medial condyle of the tibia approximately 4 cm distal to the joint line. The deep component of the medial collateral ligament fibers originate from the medial joint capsule and are attached to the medial meniscus. The fibers of the posterior part of the ligament are short and incline backwards as they descend. They are inserted into the tibia above the groove of the semimembranosus muscle. The anterior part of the ligament is flat and about 10 cm long, which inclines forwards as it descends. It is inserted into the medial surface of the body of the tibia about 2.5 cm below the level of the tibial condyle. Crossing on top of the lower part of the medial collateral ligament is the pes anserinus tendon complex. These are the joint tendons of the sartorius, gracilis, and semitendinosus muscles. A bursa lies between the medial collateral ligament and the pes anserinus. The lateral collateral ligament of the knee. The lateral collateral ligament, or the fibular collateral ligament, is part of the complex of ligaments collectively named the posterolateral corner. The lateral collateral ligament is separated from the lateral meniscus by a fat pad. The lateral collateral ligament is more rounded, more narrow, and less broad than its medial counterpart. It stretches obliquely downwards and backwards from the lateral epicondyle of the femur to the head of the fibula below. In contrast to the medial collateral ligament, it is fused with neither the capsular ligaments nor the lateral meniscus. Both collateral ligaments are taut when the knee joint is in extension. The patella ligament. The patella ligament is best demonstrated with the knee at 90 degrees flexion so that the ligament becomes taut and prominent. It starts from the pointed inferior border of the patella and connects to the tibial tuberosity. Placing modest pressure with your thumb demonstrates a springy sensation. The deltoid or medial tibiotalar ligament of the ankle. The medial ligament of the talocrural joint or deltoid ligament is a strong, flat, triangular band. It is attached above the apex of the medial malleolus over the anterior and posterior borders. It consists of 2 sets of fibers, superficial and deep. Place the foot in eversion to tense the medial ligament and start with your thumb to palpate just below the medial malleolus, starting from the posterior fibers of the calcaneal attachments or until you reach the more anterior fibers of the tibionavicular ligament. The lateral ligaments of the ankle. The lateral ligaments of the ankle are divided into 3. the anterior superficial talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. Place the ankle in inversion and with your thumb feel each ligament in turn. The iliolumbar ligament. This is attached to the posterior superior surface of the ilium, approximately 1 inch lateral and superior to the posterior inferior iliac spine. The deep portion of the ligament is not palpable, but the superficial portion is. It is best to place the patient in a prone position. It is not easy to palpate it, as it is embedded in layers of muscle and fascia, and its iliac attachment lies on the deep inner surface of the ilium, below the level of the iliac crest. To palpate this tissue indirectly, exert firm pressure along the border of the iliac crest, about 1 inch lateral to the posterior superior iliac spine, and move towards the tips of the transverse process of L5 and sometimes over L4.